Welcome to this core lecture on male ruminants. Let's start with bulls. To conduct a breeding soundness examination on a bull, he is restrained in a chute. After a cursory physical examination, including an appraisal of his conformation, eyes and feet, a transrectal examination of his internal genitalia is done. His seminal vesicles, ampullae, internal inguinal openings, and prostate gland are examined for abnormalities. The most likely site for pathology would be in the seminal vesicles, especially in young bulls when Arcanobacter pyogenes is a particular problem. It causes pain and swelling in these glands with pus in the semen and an overall degradation of semen quality. Unfortunately, most young bulls overcome this infection spontaneously. The next major point of importance is the scrotal circumference. Minimum scrotal circumference has been ascertained for all major breeds, and if the scrotal circumference falls below those minimum standards, the bull is automatically excluded as a breeding sire. This is important because scrotal circumference is not only positively correlated to sperm production, but is also negatively correlated to the age of the female offspring of this bull when they reach puberty. I know that sounds amazing, but it is indeed the case. If you're interested to know how this works, I will be pleased to explain it sometime. The next thing to do is to obtain a semen sample from the bull. This is done by using electroejaculation in most cases, because it is very time-consuming and inconvenient to train a bull to use an artificial vagina. Contrary to what you may be thinking, electroejaculation is not as horrific as it might appear to be at first glance. Although this is done under general anesthesia in humans, tests have been conducted on this technique in non-medicated animals, and they suggest that it is no more stressful than loading and offloading animals for transport. Nevertheless, these animals experience significant muscle contractions during the procedure, and precautions must be taken to prevent them from slipping or falling in the chute during electroejaculation. Having done many hundreds of these examinations, there is no doubt in my mind, however, that electroejaculation in the hands of an inexperienced operator may cause significant discomfort.
Oh, that's painful, man.
Therefore, it is important to be trained in the proper use of this equipment. The penis of the bull can be extended by using the electroejaculator with very mild stimulation. This gives one the opportunity to grasp the penis and examine it closely for pathology. After this has been done, the bull is stimulated to ejaculate. This usually occurs within 15 to 20 seconds. Now, although the volume of semen varies greatly, this image shows a rather typical ejaculate of about 4 to 6 ml. Bovine semen is about 10 times as concentrated as the semen from a stallion. But as remarkable as this may be, it is still not as concentrated as the semen of bucks and rams. This movie clip shows the wave motility that is typical of a ruminant ejaculate. If it is examined within an air bubble under a cover slip, individual motility can be appreciated more easily. So let's take a look at that. Smears that are colored with special stains are always made during semen evaluation. This makes it possible to examine sperm morphology accurately, especially under oil immersion. The numbers of normal and abnormal spermatozoa are noted, and the types of abnormalities are described as well. Many of these abnormalities have been classified and are important causes of infertility in bulls. When these data have been assembled, they're amalgamated into a score to determine if the bull passes its breeding soundness examination. The factors considered are motility, morphology, and scrotal circumference. You will notice that the number of spermatozoa are not included in this determination. That is because sperm numbers vary greatly using electroejaculation, so much so that they are practically worthless in breeding soundness evaluations. As you can see, minimum values are assigned to each of these important categories. In general, at least 60% of the spermatozoa should be motile, at least 60% should have normal morphology, and, as mentioned earlier, the bull should possess a minimum scrotal size for his particular breed. There are a large number of penile abnormalities in bulls, represented here by only 3 examples. Penile deviations such as corkscrew abnormalities and rainbow deviations such as this one are not uncommon. Persistent frenulums such as this one are found in young animals because of failure of the frenulum to break down under the effect of androgens at puberty. Although these can be easily corrected by surgery, they may reflect underlying heritable weaknesses, so culling of affected bulls should be strongly considered. One of the most ubiquitous of penile abnormalities is papillomatosis. Usually found in young bulls, it's caused by bovine papillomavirus, similar to the condition in humans, and it is in fact used to study human papillomatosis. Like human genital papillomatosis, it will resolve spontaneously without treatment, in most cases because of immunological suppression. However, in immunosuppressed animals, it has been associated with neoplasia, not cervical, as in women, but bladder and intestinal neoplasia. There are at least 10 different bovine papillomaviruses, so the association between dermal and penile papillomatosis is not consistent. But in some cases, genital papillomatosis has been shown to spread to the skin of the affected bulls. If a papilloma persists for a long time, becomes traumatized, infected, or interferes with breeding, surgical treatment may be required. Autogenous vaccines are of questionable value, so they're seldom used. From our discussion on prolapsed vagina, you may remember that I mentioned that predisposition of polled Hereford bulls to prolapsed prepuces. This has nothing to do with estrogens as it does in cows, but is due to underdevelopment of the retractor preputiae muscles in these bulls. That is, the muscle that pulls the preputial mucosa back into the sheath. When this muscle does not function properly, the preputial mucosa hangs out of the prepuce, allowing it to become damaged. In other animals, however, like this Brahman bull, there is just too much preputial mucosa to start with, so it often just hangs out and inevitably becomes damaged on grass, rocks, and other sharp creations of Mother Nature. So you can see here that there are 2 main mechanisms underlying damage to the preputial membrane: underdeveloped muscles and just too much mucosa for even the best muscle to cope with. So what would you do if the preputial membrane was damaged? I think the answer is pretty obvious. While making sure that the bull can still urinate, as you see here, one would treat the damaged tissue, then compress and suspend it if necessary until healing had occurred. Here is something that is unique to bulls. First of all, bear in mind that the blood pressure inside the penis during a full erection is about as high as that in your car tires. Now suppose the bull inserts his penis into the vagina and overshoots the cow with his substantial body weight and enthusiasm.
That's painful, man.
You can appreciate that abnormal leverage can occur on the dorsal section of the penis where it enters the vulvar lips. This leverage causes the fibrous tunic around the penis, the tunica albuginea, to rip on the dorsal surface right here. There is an explosive hemorrhage into that area, damaging the dorsal nerve of the penis, which is right in its path.
That's so.
Take a look at this massive hematoma in this dissection. Somewhere in that hematoma lies a very much destroyed dorsal nerve of the penis. Obviously, this puts the bull out of service for several months, and in many cases destroys the sensation from the glans penis. The end result is that the bull cannot sense his entry into vulvar lips, and therefore is unable to breed efficiently. This spells the end of his life as a stud bull. In some cases, these animals will recover completely, but when the damage is severe, the prognosis is poor. Unfortunately, one never knows exactly how poor the prognosis is until 6 to 12 months have passed and the breeding efficiency of the bull can be reassessed. Also, with regard to treatment, it doesn't seem to make too much difference whether one just uses benign neglect or performs surgery to repair the rent in the tunica albuginea. Now, let's switch our attention to small ruminants, the buck and the ram. As for bulls, let's first discuss breeding soundness evaluation briefly. Like bulls, rams are electroejaculated to collect semen. This can be done with bucks as well, but because of their temperament, it is advisable to tranquilize goats before electroejaculation is used. For the small ruminants, the process of electroejaculation is very similar to that used in bulls, but as mentioned earlier, the semen of rams and bucks is extremely dense. Also, because of strict selection for fertility, the quality of semen in rams is astoundingly good. With regard to pathology, let's start off with scrotal hernias. Scrotal hernias are not that uncommon in rams, and sometimes they can be very dramatic, as shown here, or perhaps less obvious, as shown at right. In the second case, one might even suspect that the ram has orchitis, inflammation of the testicle, but this and all other conditions can be rapidly excluded by examining the scrotum using ultrasonography. In many cases, intestines can be seen within the scrotum. Although these hernias are not life-threatening in most cases, they increase the internal temperature of the scrotum, and this inhibits spermatogenesis to the point of severe infertility. The heritability of scrotal hernias is still not clear, but because of the potential for heritability, affected rams should probably be culled from the flock. Surgical treatment has been described, but this is probably not advisable. Now let's turn our attention to Brucella ovis infection. This is an occasional problem in rams causing severe epididymitis and infertility. If the epididymitis is bilateral, the ram can be sterile. Usually, the ram shows no signs of infection apart from a hard, swollen epididymis, either unilateral or bilateral. It is usually not a painful condition. Although Brucella ovis is not generally thought of as an abortifacient disease, abortions do occasionally occur in infected flocks. Neutrophils in the semen of affected rams are strongly indicative of Brucella ovis infection, but many rams may carry and shed Brucella ovis, showing no signs of infection at all. This is important, and it underlines the need for serological testing for proper control of the disease, especially when rams are to be exported internationally. For details on the exact tests required for export for this disease and all other diseases, it's best to consult one's local veterinary regulatory authorities. Brucella ovis is transmitted from one ram to another through contact with common ewes, but interestingly, it is also transmitted orally when one ram mounts another in a display of dominance. Apparently, it's common for the subservient ram to lick the penis of the dominant ram, receiving the infection from that animal. Amazing, but true. Remember that male sheep and goats both have this structure on the end of the penis, the processus urethralis, an occasional site for urolithiasis. However, in this case, it appears to be perfectly healthy. Unlike the situation here, the ram at rut has a condition colloquially known as pizzle rot. Pizzle rot is irritation and secondary infection of the prepuce due to ammonia generation by various bacteria, including Brevibacterium ammoniagenes, Corynebacterium renale, etc. Now don't try and remember those because there are many others as well. And this happens when the urine contains large amounts of urea because of a high protein diet. These bacteria produce urease and break down urea, forming ammonia, which in turn is highly irritating to mucous membranes. Secondary infection causes posthitis, that is, inflammation of the prepuce, and occasionally the scar tissue that forms as a result contracts within the prepuce, causing phimosis, that is, an inability to protrude the penis. With the irritation and ulceration of the area, the pain of the condition also prevents the ram from breeding.
Oh, that's painful, man.
Treatment of pizzle rot consists of cleaning and local medication of the lesion with an antibacterial ointment. The ram should also be given thick, clean bedding to facilitate drying of the affected area. One should also feed more grass hay than legume hay to decrease the amount of protein in the diet. As you will recall from basic physiology, it is essential for the scrotum to be a few degrees cooler than body temperature. If the scrotum is covered with wool because of selection for wool production, as is seen here, the scrotum is insulated and spermatogenesis will be inhibited as a result. This can cause infertility. Bear in mind that the duration of spermatogenesis is just over 2 months long in ruminants. Therefore, sharing of the rams, including their scrotums, should occur 2.5 months before breeding starts. Thanks.